You're welcome to Nest Connect Institute. This is your preferable platform when you can get wonderful and insightful videos on various topics that we need to consider. In this video, I'll focus on cerebral vascular accident. I should emphasize that cerebral vascular accident, CVA, it's also known as stroke. So the two terms are synonymous. By definition, I should emphasize that cerebral vascular accident, which I was terming that this is a stroke. It is a condition in which there is a sudden impairment of cerebral circulation in one or more of the blood vessels supplying the brain. And this will result in interruption or diminishing oxygen supply, leading to damage or necrosis in the brain. Now, being an accident is all about the disruption that will be noticed in the supply of blood in the brain. And the word cerebral, the root word is just the brain itself. And because of that disruption, we understand that what flows in blood vessels is blood, and one component which we are so much interested in this condition, it is oxygen. When this has been impaired, the supply of oxygen has been impaired, it may lead to necrosis or just damage in the brain tissues. Now, this demonstrates, it's an image which is demonstrating the disruption itself. In the first image, which we are able to note up here, we have a blockage. In the second image, we have the rupture of the blood vessels. And because of this is resulting in the disruption in supply of oxygen. The causes of CVA, actually, they are classified into three: cerebral thrombosis, which is the most common, and usually this will be noticed in the middle-aged and the elderly people. And usually this is as a result of an obstruction of a blood vessel by a clot. That's why it is termed as cerebral thrombosis. Secondly is cerebral embolism. An emboli will be formed, which will lead to the disruption in flow of this supply. Then thirdly, we have cerebral hemorrhage. This is all about bleeding, and this may result from chronic hypertension or any aneurysms, which may cause sudden rupture of the cerebral artery. Then apart from this, it's very important also to take note that CVA is in two types. We have ischemic and hemorrhagic CVA. Ischemic, it is as a result of the absence of oxygen, which is demonstrated in the first diagram we're able to see. Then secondly, we have hemorrhagic stroke, which is as a result of the bleeding that may just be noticed as occurring. So it's important to take note that types of stroke, we have ischemic and hemorrhagic. In other literature, the third type can also be, I think, added up. But for the sake of this presentation, we have two types of CVA, all right, which is further demonstrated in this diagram or picture. The risk factors would include history of atherosclerosis, hypertension, arrhythmias, rheumatic heart disease, diabetes mellitus itself. Then apart from this, the risk factors may also include lack of exercise, the use of oral contraceptives, the smoking, the gout, cardiac enlargement, a family history of CVA. On the clinical manifestations, in an individual who has suffered a stroke, what will be seen? Firstly, there will be sudden loss of consciousness at times or deterioration in the level of consciousness. Then apart from this, what can also be noticed is paralysis, which can either be left or right-sided paralysis, and this is termed as hemiplegia. Hemi is half. Now, if severe occurs in the left hemisphere, there will be paralysis on the right side and vice versa. So if someone is suffering from severe that has occurred on the right side of the brain, what will be noticed as in the signs and symptoms will be so much pronounced in the opposite. Okay. Then in some patients, there will be a sudden onset of hemiparesis, that is numbness or partial paralysis. Gradual onset of dizziness, aphasia, usually this is very common, the loss of speech, changes in the level of consciousness, decreased attention span. All this is noticed. Then apart from this, it's also very important to take note that in these patients, usually they will have difficulties in comprehension. They easily forget, lack of motivation, urinary incontinence, and at times it can also lead to fecal incontinence, visual impairment, loss of sensory perception. On the diagnosis, it's important that we begin with history taking, though it has not been projected here. So history taking is critical. Secondly, we need to do physical examination. Then apart from that, then we can go into details of cerebral angiography, computerized tomography, magnetic resonance imaging. All these are so critical because they will demonstrate the disruption which has led to CVA. Then it's also very important at times to do ophthalmoscopy, EEG, okay, coagulational studies because of the thrombi. Then full blood count can also be undertaken or done. Treatment, usually this is begun as early as possible. And treatment should also include rehabilitation, modification in the diet, all right? And on the drugs, we'll have anticonvulsants, and the examples would include phenytoin or phenobarbital. This is just to prevent seizures. Corticosteroid, dexamethasone to minimize associated cerebral edema. We know they are inflammatory processes. Analgesics such as codeine to relieve headache. And coagulants such as heparin are very critical and play a critical role. On the complications, infections such as encephalitis, brain abscess, pneumonia may result, sensory impairment, visual impairment, aspiration contractures. All these mainly are attributed to the immobility. On the nursing management, it's important to take note that CVA is an emergency and therefore we need to resuscitate, okay? Now, the general points on nursing management would include to maintain a clear airway, to maintain patient's nutritional status, to prevent complications, and to rehabilitate the patient. Now, during the acute phase, when this condition has just occurred, it's important that this patient is nursed in a quiet place free of disturbances. The room should be clean, warm, and well ventilated. Maintaining of a patent airway would be very important because this may just lead to oxygenation. If unconscious, the patient should be nursed in a recumbent position, which lead to one side to allow drainage for secretions. It's also very important that we need to loosen tight clothes, aspirate secretion from the mouth or nose, insert an artificial airway, and start mechanical ventilation. Observe vital signs and neurological status. It's very important that this patient at times would need to be fed through an NG tube. Then apart from this, it's also very important that you ensure that the patient is turned every after 2 hours to prevent pressure sore formation. Assisting of the patient in doing exercises becomes so important, especially if they're improving. Now, It's also very critical that we ensure that we do exercises, because the patient will have to maintain their muscle tone. Okay, establishing and maintaining communication with the patient is so important. Remember, these patients have aphasia. Okay, protect the patient from injury. For example, if we notice that they are usually convulsing, you can ensure that you give them, you put them in beds which are bed railed. IEC teach the patient and family about the disorder, explaining the tests. If necessary, we need to teach self-care activities such as combining hair dressing and washing, all that. Involve speech therapists, okay? And you can actually get this notes per request. You can just drop your email and I'll be glad to share notes with you. Now, this question demonstrates what we just been learning. And in the first one, it says explain two cardinal causes of cerebrovascular accident, state 5 investigation that will be done, describe the management in the acute phase. Now, in the acute phase, this is the phase when that condition has just occurred. And when you are writing, you should include the issue of, if possible, ensuring that this patient has been subjected to resuscitative measures, the ABC, airway, breathing, and circulation. Explain 5 complications of CVA. That's another question that you are able to answer. Thank you for listening to this and watching this video. Ensure that you subscribe to this channel for more and more videos.